When I started doing transplants in the early 1980s, CMV was the main killer of our patients from an infectious disease point of view. Over these several decades, this has changed in a very positive way because we have learned how to manage CMV much better. So today, CMV is manageable with either a prophylactic strategy with antiviral drugs or with early diagnosis and early treatment. It's still significant, it's still important, but not the way it was when I started by now many years ago. On the other hand, we all the time get new challenges with viruses. And the most typical example of that is, of course, the COVID pandemic and the emergence of new viruses. This has happened by now a couple of times where EBMT has played an important part. First, it was the swine flu pandemic, by now almost 15 years ago, and then, of course, COVID-19. And there will be new pandemics for sure. And in that situation, to have a registry that can quickly collect data and learn more about these challenges are extremely important. When the SARS coronavirus 2 pandemic, also called COVID-19, started in early 2020, we knew very little. We had only some reports from China and very early reports when the virus came to Europe and North America. This meant that everybody was asking questions and we had absolutely no answers. The way we dealt with that in the Working Party and the EBMT Registry was to create a case record form to, as quickly as possible, gather information on patients' risk factors and outcome of the infection. At the same time, we worked very closely with other scientific societies, such as the European Hematology Association and also our North American colleagues that had faced exactly the same challenges and had to do it similarly. Together, we started developing guidelines on what we thought we knew, how these patients should be managed, and to give advice as well as we could in the early phase of the pandemic. And this resulted in that we had several of these updates about every 2 weeks with new information. As time went by during the pandemic, a lot of other guidelines came out, and also, of course, government regulations in several countries, and these were overriding of what we could do, but we continued to gather information. We published a paper on recommendations, and we rather quickly also published a paper on outcome of patients. When we came to the end of 2020, early 2021, new vaccines emerged, and then another need was created, how to deal with vaccination of these patients. So besides the regular management guidelines, we also started to produce vaccination guidelines. So I don't think we can overstate the importance of what we learned in the EBMT registry with the help of all centers, all data managers, many physicians that took the time to report their patients to us, allowing us to summarize and get better knowledge about this pandemic. The EBMT registry has now been in existence since the late 1980s. We have just put in a major effort based, among other things, on an EU grant to update the registry into a new package, both regarding the database, making it more possible to exchange the information with other partners, but also how to collect the information. Our hope is that we will be a major source for centers, for natural registries, and for the scientific community in learning more about these patients and forward the science, as we have done now for many years, and that we will keep that role in the future. The EBMT has a long history of close collaboration between different scientists in Europe in our so-called working parties. This makes it possible to rapidly gather new information and to perform studies that will help patients into the future. In the beginning of our history, the main importance was to improve patient survival. We have been able to do that with a lot of studies over the years, and thereby helping centers and patients how this type of treatment should be performed to get the best outcome. This has resulted in an increased number of long-term survivors, but we know that they are facing late effects that impact their quality of life. And I think an important task for the EBMT into the future is to listen to the patients, how they are experiencing these late effects, and find ways to improve the quality of life for our long-term survivors. We in the EBMT certainly realize that to report data to the EBMT Registry is a demanding task for many centers and needs resources at the centers, particularly from their data managers. However, I'm a strong believer that this in the long run will benefit our patients by getting the critical information, particularly about new therapies, about new ways of doing cellular therapy and stem cell transplantation, and also about complications such as newly emerging infections. I hope that the resources spent in data management and reporting to the registry can be seen as a benefit that the EBMT can give back to the transplant world and with a common aim to improve the care for our patients.